Gallstones.
A gallstone. Okay.
Okay, my name is Kevin Hernández, and today I'm gonna talk about gallstones and acute cholecystitis. I cover what gallstones are how they can lead to acute cholecystitis. I hope you could find this information helpful. What are gallstones? Gallstones are small, hard particles that form in the gallbladder. They are usually made of cholesterol or bile pigments and can range in size because it depends what it's made of cholesterol or bile pigment, and it could be a small and large particle. It depends amount of what is cholesterol is made of. Okay, so the gallbladder is a small organ located under the liver on the right side of the abdomen. Let me see if I can share the laser in the right side of the abdomen. And it stores bile, a fluid that helps digest fats. The human body digests so many nutrients, but fats depends almost directly from the gallbladder. The gallbladder stores the fats and it drains to the liver. The liver converts that in another nutrients like glucose or other things that helps the body works on. Okay, and how the gallstone cause problems. The gallstone can block the cystic duct. The cystic duct, let me share a little bit this presentation again. This is the gallbladder and this is the cystic duct. It's directed in juxtaposition to the gallbladder. So it drains directly in the cystic duct. So when the gallstone can block the cystic duct, stopping the gallbladder from draining properly. This blockage often causes a condition called acute cholecystitis, which means inflammation of the gallbladder. In about 95% of cases, there are gallstones inside the gallbladder, or it's called calculus cholecystitis. But in rare cases, there is not gallstones. Gallstones is a contraction for gall, for maze in the gallbladder, and stones that is formed like a stone. And in these cases, it's called a calculus cholecystitis, especially in patients who are very ill or are receiving parenteral nutrition. But if I say parenteral nutrition, do you know what I mean?
Yes, I know.
Uh, I'm going to describe a little bit more what is parenteral nutrition. Parenteral nutrition is when a person receives nutrients directly into the bloodstream through an intravenous line. Like we can see in this image, this picture shows the parenteral nutrition and it directly drains in the vein, the principal vein, or almost often in the superior vena cava. This is used when someone cannot eat normally, such a patient in intensive care without regular food intake. The gallbladder doesn't not work properly or not get stimulates to empty. So the pressure, like this picture shows, can grow and lead to inflammation, even without gallstones. As we can see in this picture, there is no gallstone inside, but the pressure is up or increase the pressure.
I have one question.
Okay.
In that case, I'm sorry to interrupt, but in what clinical situation is a parenteral nutrition preferred to do the enteral overfeeding or the feeding process?
Parenteral nutrition is using in so many cases. So, for example, a patient under sepsis or an infection is too hard to fighting himself. So, in other cases, for example, cancer, the patient can eat normally, so it needs parenteral nutrition to get daily nutrients because it's important to keep it the normal function of the body even without
Mm,
normally eating. So
yes.
is that the key word? That's the
But
key part.
yes, correct. But
Mhm.
what are the potential complications that a patient can have if you proceed that way with parental nutrition?
Without
Eh,
parenteral nutrition.
No, no. What are the potential complications that are
Mhm.
associated with a long-term parental
Long-term
nutrition?
parental, long-term parental nutrition can this shares in another case for infection in the
Mm,
skin,
mm-hmm,
uh, or can happens, for example, discomfort in the body, but
mm-hmm,
because this it changes the components of the bloodstreams. For example,
okay.
bloodstreams, they are nutrients that are in specific contents or measure. So it
Mm,
can change if you put parenteral nutrition in long term, and it
mm,
can be harm to the human body instead of being
mm,
good. So it's
mm,
important to keep this parenteral nutrition uh, in some cases or specific cases, but in short terms, not in long terms,
not in
because
law. Okay,
Mhm.
thank you.
The symptom of the acute cholecystitis. The symptoms can be pain in the upper right abdomen. As we can see in this image, the abdomen is divided in four quadrants. The left upper quadrant, right upper quadrant, right lower quadrant, and left lower quadrant. And the gallbladder is located in the right upper quadrant. So the pain can appear in this location, but
Mm,
also can radiate to the right shoulder
mm-hmm, mm-hmm.
and can
Oh,
happen with fever, nausea, and vomiting, fast heart rate, fast breathing, and tenderness on the right upper quadrant. And it's important to describe what is morphine side. Murphy sign is when the doctor touch the upper right abdominal quadrant and the patient with a deep breath feel pain in that location. Or in other words, is pain during a deep breath when pressing on the gallbladder area.
mm, mm-hmm,
What is a diagnosis? The diagnosis is for imaging tests. The
mm,
first imaging test is ultrasound that can show gallstones and thick wall or fluids. For example, in this image, we can see a gallbladder. In the inside, there are gallstones and is formed as shadows in juxtaposition in the posteriors that mark the weight that is an object that doesn't belong to the body and is located in that position and interpose in directly in the image and form shadows like a shooting star. For example, other imaging tests can be MRCP or magnetic resonance cholangiopancreatography. It may be used to see the bile ducts in more details. For example, in this image, we can see more details or more anatomic, the gallbladder, the cystic duct, and the cone bile duct. It's formed in a 3D image and it can be used to see in more details if the doctor or the physician suspects that it can be a stone in there. Okay, what is the treatment? The treatment depends on the severity of the condition. For example, there are two clinic situations for biliary colic. Biliary colic causes temporary pain without infection, and acute cholecystitis that involves inflammation and infection. One's need require less urgent care, but on the other hand, acute cholecystitis need prompt and more intensive treatment to avoid serious complications.
Mhm.
So the treatment for acute cholecystitis is also, first of all, a hospital admission because it's something urgent. Nil by month. What is nil by month? It's not eating or not drinking. It's a medical term to describe not eating or not drinking for the patients. Uh, IV fluids and antibiotics. For example, ampicillin, sulbactam is most often or common antibiotics. Pain control for intravenous line and surgery cholecystectomy within 72 hours because it's something that is urgent and need prompt care.
Mm.
In other hand, biliary colics is more it's a temporary blockage of the cystic duct, causing pain but no inflammation. The management is pain relief with painkillers or can be used ibuprofen or something like that, also omeprazole. It can be surgery related to prevent future attacks. It's a elective or well-planned surgery, but because it's not urgent, so it can be planned in long term to prevent another attack in the future. Possible complication. I talk about sepsis. Sepsis is happen when an infection gets out of control and the body starts to harm himself instead of just fighting the infection. It's an infection that is severe, so the body doesn't know how to fight and get out of control, and is bad for the body, is harm because the sepsis happen when the infection is very severe. Or for example, empyema means the gallbladder is filled with infected fluids or pus in the gallbladder, which make the condition worse. Like we can see in this image, and that it shows gallbladder vomiting.
Oh my God.
Uh, Gangrene is a serious condition that happens when tissue dies because it doesn't get enough blood supply.
Mhm.
Gangrene, the tissue dies because poor blood flow. Gangrene, as we can see in this image, there's a mnemonic to remember what is gangrene. There's
Mhm.
signs for loss of temperature, loss of portion, loss of sensation, loss of color, or loss of function. Also, the tissue becomes dark and black.
Mhm.
It describes that the tissue dies. Perforation is when the gallbladder bursts or tears, spilling its contents inside the body.
Mhm.
This image, I don't know if you can see, there's an image under dia the diaphragm that shows something dark that is
Well,
marked
I
with
can see something that is like a shadow.
like a
Okay.
shadow. That's correct.
Yeah. Uh-huh.
That means that is air in there. That
Oh,
air is also a description for perforation because there's an organ that is perforating and also fluids air in that part of the body.
I can see. Well, when a patient gets into that situation, is like a terminal
Yes,
symptoms.
it's
And
very
it's
severe.
hard, but I don't know, many people, maybe you can have some symptoms to say that something is not working good. But when you get into the gangrene, I mean, that's the top part of the symptoms. You need to
Yes,
go to the doctor easily, I mean, quickly.
yes, that's correct. I have a patient case example. Uh,
Mm-hmm.
it's not Lady Gaga. Lady Gaga is just only in the image. A 40 years old female has been experiencing upper right abdominal pain after eating fatty foods for the past few weeks. She also reports nausea and has had a fever for the last 2 days. The patient has had occasional stomach discomfort in the past, but this pain has been more severe recently. She visited a doctor yesterday who performed an ultrasound today. The scan showed gallstones and thick gallbladder wall. The doctor has ruled other causes and diagnosed her with acute cholecystitis. Since the patient has had pain and site of infection, she will be admitted for further care. This shows a acute cholecystitis case. It depends for the description. It can be more symptoms and signs, and it depends
Yes.
also, it can has more symptoms and signs, and it depends on the patient because
Sure.
also every person has a limit or a limit, yes, a limit for the pain.
Yeah.
What it can uh, have is severe or not severe for there. So it can depend when early comes to the doctor or goes to the doctor to seek medical care.
And also it depends on some people feel sick really quick and they can have the pain and they can feel it. But some of them are dying, they don't feel anything. So
Yes.
it's what they call the topic, the humor of the pain.
The human brain, I want to say that, the human brain.
Mhm.
Also, there is some people who are weak. The human brain is so low, so barely a pain that is an easy pain can be
Mhm.
turned in a hard pain to that kind of person.
Yeah.
Okay, in grammar notes, we use present perfect. Like I said before, the patient has had pain. She visited her doctor, past simple, and the scan show gallstones is past simple too. Um, for the final slide, I wanted to share a quote. Life is a one-time offer. Use it, use it well. Because in the life is such challenge that in front you or you can take it or not, but you can do it your best to get or achieve your dreams. So I
Mhm.
think it's the best description for this and the best description for AmankayHowto to develop English keys skills to talk in an easy way. That's all.
Oh my God, that was amazing, beautiful. The last message, I just love it. I just love it. Oh my God, you gave us through this video and this presentation a real learning experience about this topic. Congratulations, Kevin. Your English was so and is still great. I mean, the way that you manage the topics and also your vocabulary is amazing, is really great. And let me tell you that your accent is like a British accent. So it's great. It's great. It's not like mine, like American accent, but it's excellent. I wanted just to let you know that when we were talking about umbrella, is called pain threshold. Pain threshold is the same thing what we call the humoral of the pain, but that was easy. It's just like you say, she has a high pain threshold. She has
Stressful.
that high pain threshold, so she doesn't feel pain easily. Okay, so
Okay.
that's the way we manage that topic and that vocabulary. But the rest was fantastic, fantastic. Congratulations. You deserve the best. And you can make presentations anywhere you go. And also, if you present in Europe, this kind of topic, you're going to be so successful. So congratulations again. I have a few questions here. And the first one is, how does calculus cholesterol differ from a calculus cholecystitis? What is the
Uh,
difference,
the
Kevin?
difference is if when the gallbladders have calculus inside, because a calculus means without. A
Mm,
calculus is without gallstones inside. So
mm,
it's like I described before, it's
mhm,
only inflammation inside the gallbladder without gallstones, and also it turns to increase the pressure inside the
mm,
gallbladder without a gallstones forms. In other hand, gallstones or calculus cholecystitis is when there are gallstones formed by cholesterol. So that's the difference. One
mm.
is without, and the other one is with gallstones.
Ah, okay. And how a patient reduce the risk to develop this inflammation or develop this sickness?
That
What is the primary?
The primary care is with diet.
With diet.
Yes, because we had to choose carefully our foods, uh, hunk foods, fast foods. That is the worst thing
Yes.
to our body. So we had to skip that kind of food and to choose a more where or nutrients like a vegetable or something like that. And also we had to eat in hour or at the time, because if we eat in different time per day, it can turn in a disaster.
Mm,
We are humans are scheduled, so
mhm,
our inner body has schedule too, so we had to fit in that way. So it had to be more normal to be organized. So
mm,
it's difficult, but it's the only way to get through that.
mhm. Thank you so much. Thank you so much. Awesome presentation. Kevin, you are the best.